Hello friends, myself Dr. Tapas Kumar Pal. As we are continuing with the topic of TENS and its placements and the different types of TENS. As we promised on the last video, those who watched the last video, they understood that the different types of the TENS and the parameters of the TENS. And today we will teach you regarding the placement of the TENS for the conventional and the burst and how exactly the contraction looks like. That means the time we will be using the conventional TENS, how it looks like, and the time we will be using the burst TENS, how it looks like. And as practically today we will learn the conventional TENS, how to decide the parameters, and the time we will use the conventional TENS for suppose median nerve radiculopathy, how it exactly looks, and the time we will be using any type of muscular pain as a example, any type of muscle spasm of the extensor groups of the muscles of the forearm. The time we will be using the burst TENS, how the contraction looks like. Come, so let everyone join with us to learn the practical way of learning the conventional burst and the other parts of or other parameters of the TENS, how to decide and where exactly to keep. Come, let's everyone will watch now. So now I will show you, we decided the conventional TENS now. I kept the frequency knob as a high. As I told, the frequency knob for the conventional TENS, it's supposed to be within the 100 to 180 hertz. So I kept that the frequency knob over here, and so where I kept this pulse width knob, so this is within the 20 to 80 as a low. So high frequency and the low pulse width, and the knob is in the frequency part. So now I will increase the intensity, and I will show you how the contraction looks like. So I am increasing the intensity over here, and the time the intensity is getting increased, we can see I can feel the contraction over here. কি হলো না না চলছে Now friends, I will be showing you the burst TENS. As on the last class I told you, this burst TENS, it works when the frequency it is low. So I keep the frequency knob as low, like within 40 to 80, and I will keep the pulse width knob as high, so above 100. So I keep the pulse width knob high, and this knob it is in the burst mode. And now I will increase the intensity, and I will show you how the contraction it is happening. You can see the contraction. This is the burst TENS. So this burst TENS, it works whenever a patient used to have a muscle spasm, and that is the time, or any type of whole muscle spasm, or any type of spasmodic pain of a particular group of muscles, any taut band formation of a muscle. That is the time this burst TENS is used. To remember the burst TENS, it is you can only give within a 15 minutes of duration. As conventional TENS, it is for only 20 minutes of duration. For the burst TENS, you need to go with a 15 minutes of duration. Now the third one I will show you, that is the acupuncture type of TENS. For the acupuncture type of TENS, what you have to keep, you need to keep the frequency as high frequency. So I keep the frequency also high, I will keep the pulse width also high, and this knob it is in a mid portion, that means in the burst portion, and now I will increase the intensity. So this is the acupuncture type of TENS. A concentrated current, it is penetrating to my only one spot, and this is used whenever a patient used to have a trigger point type of pain, or any type of localized pain, any spot area wherever there is a trigger point formation, that is the area wherever we used to be using this acu-TENS or the acupuncture type of TENS. And again the duration is supposed to be 12 to 15 minutes for a acupuncture type of TENS. The fourth one now I will show you, that is the brief intense TENS. Brief intense TENS, where you will keep the frequency also low. See, this frequency also low, I keep the frequency low, I will keep the pulse width also low. Now I will keep the increase the intensity, but for the brief intensity it is in the continuous mode. Now I will keep the brief intensity. Very low current is coming to my hand, and this brief intense TENS, it is used whenever a patient is having a post surgical pain, any scar tissue formation and related to pain, any phantom limb pain. That is the time this brief intense TENS it is used. Again the duration for this brief intense TENS is 20 minutes. And the last one, that is your modulated tense. As for the modulated tense, what you have to do, you no need to do with the anything with the frequency knob, you no need to do with anything with the pulse width knob. Only one thing you have to do, you need to keep the knob in a polarity alteration mode, and in the polarity alteration mode automatically the machine will decide the parameters, and in the modulated tense I will increase the intensity. And what is exactly happening in the modulated tense, as we normally know, for the tense current, for the conventional or any other tense, the current is to pass from black to red, that means from the cathode to anode. But for the polarity alteration or the modulation, that is it is to happen from the black to red, red to black, from cathode to anode, anode to cathode. This is to decrease the adaptation. And whenever a patient is to come with a chronic osteoarthritis or chronic joint pain, wherever the sensation of the particular joint area is diminished, that is the time we will be using this polarity alteration or the modulated sense, and the duration for the modulated sense is supposed to be 20 to 22 minutes. So friends, in this video you clearly understood that how the contraction looks like for this particular tense machine. And the next video, just wait for, that we will show you the electrode placement. At few of the viewers and few of the physios, they asked to show the electrode placement for median nerve, for the radial nerve, for the ulnar nerve, and for the sciatica, the sciatic nerve radiculopathy, how to keep the electrodes. Yeah, there is a lot of things you need to know, the time where and how exactly you will keep the electrodes. So thanks everyone to watch this video, and the next video will be showing you that the electrode placement. And of course, those who are watching this video, those who want to learn from our channel, please do not forget to like this video and do not forget to subscribe this channel. Thank you everyone. Bye.